Hey, I'm Jasper-Jay, and recently I had a procedure done where I was awake for at least a part of it where I really shouldn't have been, and that's been on my mind a lot lately, so I thought I'd talk about that whole situation, if that's okay with you. Is it okay? Can I... Is it? So if you don't know, I'm one of those mystery queers. I call myself queer, gay, bi, pretty much interchangeably, and I'm also trans, so it really confuses the hell out of people. Recently, I confused a doctor real good when he asked me, so which did you start off as, and in which direction are you going? Bear in mind this is right after discussing the fact that I had a double mastectomy and I take testosterone. I felt inclined to yeet the teat, and I shoot myself up with man juice on a weekly basis. I wonder which direction I'm going. Where? It's a mystery. Somebody called Blue's Clues, gotta help this guy out. I'm like, shit dude, I know it's a puzzle, but why do you need this particular information for my endoscopy? My surprisingly, I know, have nothing to do with my digestive system. Honestly, between this conversation and the 1-star Google review, I should have seen this coming. I should have known that this was gonna traumatize me. The worst part is, it's a 2-part procedure. So I have an appointment coming up on October 6th to get another scope done with this guy. Oh, if you don't know why I'm getting multiple scopes done, I've been sick for a while, like really sick. These last few months, I've grown rather close to a bucket that I've decided to name Bucky because I really like alliteration. In all honesty, it's pretty serious. I've lost about 20 pounds at this point, probably more. I don't weigh myself much. I don't like scales. I just don't. I hope there's no scales watching that I've offended. Sometimes I just wake up in the middle of the night choking on my own stomach acid, and it's not fun or fresh. At one point, I actually burst a bunch of blood vessels in my face the day after dyeing my hair red, which, you know, just really made it pop. Not the blood, that's not what made my blood. Why am I explaining this? So what's causing all this commotion? Why am I like dying at the age of 24? I have GERD and strictures. So I have a loose sphincter and a tight food tube. So I need the endoscopy to dilate my esophagus because, you know, my food tube's too tight. I can't get food down it to digest the food. So that's why I'm losing all the weight, and that's why, you know, my stomach acid is just like, hey, let's party. Yo, I have more scarring inside than out in both an emotional and physical sense at this point. So this procedure isn't just to like alleviate my symptoms, it's to prevent things from getting worse and to actually figure out what's going on. Because I know I have strictures and GERD, that much they could tell by just like talking to me and figuring out my symptoms and being like, oh yeah, that's what that is. There's also a risk that other things could be occurring because all of this is going on, and I actually do have a family history that, you know, puts me at a little bit of a higher risk. So knowing all of this and having my pre-procedure appointment with the doctor, there was a part of me that for just like half a second thought about maybe actually just like transferring my referral to somewhere else, because I wasn't entirely confident in the whole situation. But my procedure was scheduled for the next day and I had waited months for this appointment. I really couldn't afford for anything to get worse. I haven't been able to function. It's been bad. Honestly, I wouldn't have all this information about what was going on with me without going to that pre-op appointment. So from what I could tell at that point, he wasn't actually a bad doctor. He was just a bit of a So I was like, okay, I'm gonna swallow my pride for a moment, tough this out. My procedure was scheduled for the next day at 10:30 a.m. I had to start fasting at midnight, which meant no water, no food. When your esophagus is getting a constant acid bath, not being able to consume liquids sucks. It just sucks. There's no other way to put it. It is painful. It hurts. I woke up the next day before my procedure with an empty stomach and an acid-bathed esophagus, and I couldn't drink anything to kind of amend that, help me out maybe a little bit. So because of that, I got sick right before my procedure, and I grabbed a Bacell container, dubbed it Bucky Jr., and I was on my way. So they were running late, I was running early, which is fine. I figured I would have to wait before I got called into the room anyway. When I did get called into the room, It was by the wrong name, which sucked because there was other people in the waiting room. I corrected her, like, politely, because I'm about to be passed out on a table in this office, and I'm not looking to piss people off, but also treat people nicely when they make mistakes. It happens, people are overworked. Anyway, she had a really hard time finding a vein for the IV. She kept on trying in my hands, and I have Raynaud's, and I was also fasting, and the veins in my hands, they move around. And she kept on commenting on that for like 10 minutes until she finally tried in my arm, at which point she didn't realize that you need to wait for the alcohol to evaporate a little bit before sticking your patient with the needle, otherwise it's gonna sting like a So I explained that, and I was like, please don't stab me right away. I don't like the feel of alcohol sting. And another nurse came in and explained that, well, the first nurse was wiping me with another alcohol swab. Again, it was adding to the nervousness of the situation. So after the IV was in, finally, I was rolled into another room where they were actually going to be doing the procedure, and I was greeted by another nurse who was like, oh, so you were birth named, but now you're Alex, right? And it's just the way she said it, the excitement in her voice, the look on her face, everything, it just confirmed for me that I was like the first trans patient to ever walk through that clinic. Or hobble, rather. And I was kind of like, ah. But I did the nod and smile, and I was like, yeah, it's me. Pretty much immediately after that, it was like I wasn't in the room. They started talking about what they were going to be having for lunch, how many patients they had until lunch. Basically, they were just really fascinated with the concept of lunch. And I really felt that in that moment because I had just been fasting for 12 hours. Honestly, I was a little bit bitter because couldn't this wait until the person who's been fasting for 12 hours is unconscious, maybe. I'm going to be sedated. And then that's kind of when it really started to hit the fan. It came time for the discussion of how they were gonna knock my ass out. And I'm on pain medication, so I have a little bit more of a tolerance to sedatives that are used in procedures like this. I've been transparent about this the entire time. I mentioned on the phone while booking the appointment, hey, I smoke and I'm on. Like, I feel like that's something that's important to communicate, especially when dealing with sedation. Because I have this, like, tolerance to the sedation, they decided they were gonna start me at twice the dose needed to knock out somebody my size. They strapped a little thing to my face to keep my jaw open, and that made me panic because it was on a little too tight, so I communicated through a series of groans that it needed to be loosened. It was loosened. I was pumped full of and benzo something something. Pretty much like a minute after that, the doctor was trying to shove the scope down my throat. I was not out. I was still very much communicating with them. I don't know what the hell was supposed to be going on here. Like, I assume during this procedure you're probably supposed to be in kind of like a twilight state. I was not. I was fully conscious, fully aware. I did not feel intoxicated or like woozy at all. I was fine. And I'm just having this tube shoved down my throat, and I'm trying to be okay with it. Like, I don't know why. I was trying so hard to be okay with it, and I just panicked eventually once I felt my throat start to stretch because they're trying to dilate my esophagus, and I just, like, my hand goes and I grab the doctor's arm, at which point he's just like, oh, he's not sedated enough at all. Pulls the tube out of my throat and requests another round of sedation. So, like, I think at this point I was on 3 times what somebody my size is supposed to get. Basically, I'm on enough sedatives to knock out a f***ing horse, and I am still kicking for long enough that I remember calming down. Like, I remember focusing on my breathing, picturing like a stop sign, just being like, calm the f*** down. And, oh my god. I'm laughing about this because I go back in a couple of days, I'm gonna die. That's pretty much the end of the drama. I had a tube shoved down my throat while I was awake. It was the ultimate deep throat challenge. I did not appreciate it. I didn't sign up for it. I haven't really been able to get this out of my head because, like, I'm going back there, but honestly, it was just horrifying. It was a scary feeling. And I know people have woken up during the middle of, like, much more serious procedures before, and that's probably a much more traumatic situation. But, like, it just blows my mind because I wasn't even out yet. Like, it was a minute. I swear, it was a minute. Like, I know for a fact my eyes were open and responsive because I watched it happen in focus. Thankfully, they're adjusting this course of action, so when I do go back, there's going to be an actual anesthesiologist there and not just a nurse who does the anesthesia and the doctor telling her what he thinks is right. What? I don't know why that was the situation in the first place. I really don't. And the reason they're doing this isn't just because I was awake during a part of the procedure that I shouldn't have been. It's because I had a reaction to the anesthesia following the procedure that made me tear my throat up a little bit. Just a little bit. The tiniest amount. Small amount of bleeding and bile. Yeah, I violently reacted. So yeah, they're bringing in the anesthesiologist essentially so I don't die, because So bright side of this whole situation, because I feel like every story kind of needs a little bit of a bright side, my post-op nurse was actually really chill. His name's Joe. We love Joe. I kind of know him, not really. Like, my roommate was his patient when he was having his gallbladder removed, and he was great then. He was great with me. Like, there was no confusion with him over our gender or anything like that. He was just like a cool dude who did his job well, and I appreciate that. And, you know, we need more people like Joe in this world. So if you're somebody like Joe and you're thinking about getting into healthcare, please get into healthcare. I need you so I don't die. Yeah, that's pretty much it. I just wanted to vent about that situation a little bit. If you like this video, go ahead and give it a like. If you feel sorry for me, go ahead and give this video a like. Just subscribe if you want to subscribe. Hit the bell icon because, you know, otherwise you won't know when I post a video. Oops. Anyway, other than that, you can follow me on Twitter and Instagram, and I'll link those down in the description below. I don't have a life. I'm not a functioning human being. And that's how I keep my brain from turning to complete mush. Who am I kidding? It's too late for that. Anyway, peace out, See? Peace out, Scout people. I'll see you soon. Bye!